this is Dr. Gaurav Deka here. I am a medical doctor and a transpersonal therapist. And today here I am to talk about certain mental health issues as well as something important called inner child therapy. Let me begin with what happens when you go to a psychiatrist. You go to a psychiatrist and first of all, what finds revelation is your symptoms. They will tell you that your serotonin levels are low, or your dopamine is fading away from substantia nigra, or there is a chemical imbalance or a disbalance in the body, in the brain. Now, my idea as a medical doctor as well as a therapist is to find out what happens before that imbalance, before that disbalance. Because just before that imbalance and disbalance, there will be an event in history. We don't know where in our lives that event will be, but there will be an event. What is an event? For example, you are looking down from your veranda and seeing a car going. And it doesn't mean anything to you because you just don't know who is there in the car. However, if you know that your friend is in the car, maybe you will feel happy at that moment. Which means an event is not meaningful by itself. An event derives meaning whenever there is interaction of us with the event. And therefore, the moment there is interaction, there is also a felt sensation. There is a feeling, which is happiness in this case. And then my entire body feels happy. Now, however, if the event is a negative one, if the feeling is a negative one, for example, in the same event, I see, unfortunately, a car burning in front of me, which has my friend in it, I might be extremely scared at that moment, shocked, disconnected from my body, and I might be furious at that moment as well. So what will happen is all these negative feelings and emotion will be felt by my entire body, by my system, by my energy system, by my unconscious as well. And now the body will try to resolve it. You either talk it out with someone, you go to the police and report it, you go to therapy, but the point is you have to express at some point. If you do not express, if you do not resolve it, the body will try to resolve it. And when the body tries to resolve it through its own means, through its biology and through its physiology, then that particular feeling, that particular conflict in the body becomes a disease. So disease is not actually something that is out there to destroy us. Disease probably is a coping mechanism. When we do not resolve, our brain resolves it for us, our body resolves it for us, and that is disease. And therefore, I focus most importantly on the event, because if we go back to the event, then we also have a way of reversing that disease, reversing that event and resolving that conflict. And in that event is a part of us which is in the past. For example, if today I have a disease, if today I have a problem, there will be an event related to that problem, maybe 2 years back, 3 years back, 10 years back, 20 years back. Now, that particular 10, 22 year back me is my younger part, is my inner child. And that inner child is trapped in that event in a time energy capsule. So as therapists, what we do is we help people, first of all, discover that inner child, discover that event. And then we make them go through the event. I understand going through it might be re-traumatizing, but it is important to go through it because only then the person will be able to understand that, oh, it's over, it's done. My brain registers the fact that it was 20 years back, it no longer is available to me. My body does not need to go through it again and again and again in the form of post-traumatic stress. And therefore, when we go through it, we realize that, okay, it's over now. The adult self can acknowledge the younger self and tell the younger self that I am there with you. It's over. It's done. We can heal this part of us and we can move through it and we can integrate that healed part of us within us. That is exactly what we call as inner child therapy. There are many ways of doing inner child therapy. Things like transactional analysis, things like Gestalt therapy. These are new names, I know, but at the same point of time, the way I use it is by regression, which is by going back in time and discovering that part of us, healing that part of us, bringing out the necessary catharsis, as in the necessary release, and then integrating that part of us. That is my job as a transpersonal regression therapist. So that is all for today. Signing off from TOI Health and Fitness. Thank you so much.